Hello and welcome everybody to Medicare School Daily. It is Tuesday and we're excited to be here with you to answer all your questions with everything Medicare today and Social Security as well. Now, I'm Erica Smiley. I'm one of the educators here and also a licensed agent. And I'm here with Mr. Marvin Music, who's one of our owners and founders here. So, hey, Marvin, how are you doing today?
I'm doing very good, thank you.
Good. So, yeah, if you guys aren't familiar with MedicareSchool.com, we're the #1 educational resource on the internet, and we help thousands of people every month. So we've got about 35 guides that are trained in all things Medicare. That's all we do here. And we know it can be confusing, the timing of when to enroll, how to enroll, lots of different questions between things like Advantage plans and supplemental plans. So we're always here to help. So this show is we've been doing this about 2 weeks now, but we are here to answer your questions live. So if you want to talk to us today and you have questions, you can call the number at the bottom of the screen there. It's 833-824-2004. But first, we're going to kick off with just a daily teaching from Marvin. So Marvin, I'll turn it over to you.
All right, very good. Well, it is good to be with you. We appreciate you carving out this time to be a part of our program. We hope it's very helpful. What I want to talk about today is really a myth that occurs in the Medicare world, and that is that oftentimes people think that once they go on Medicare, if they're unhappy with their plan, dissatisfied with the plan, they can just switch very randomly. And that's not true. I want everyone to realize that there are rules, in fact, lots of rules with Medicare, and lots of rules that revolve around switching of plans. And so I want to clarify one of the biggest ones, and that is that when Medicare has this annual enrollment period annually, which is October 15th through December the 7th, that 7-week period of time is designed primarily for people that are on Advantage plans and prescription drug plans. And the reason is because both Advantage and prescription drug plans are only written for 1 year at a time. Those are calendar year plans. And so what Medicare does is it gives the insurance companies the right to change these plans annually. Frankly, they can do anything they want to do with their plan. So if I'm on a plan this year in 2026 that's Advantage or a drug plan, as we get into the annual enrollment period, the companies are given the right to do what they want. They can lower premiums, they can reduce premiums, they can change benefits, they can increase them or decrease them. They actually can even pull the plan if they're not making money on it. That's the only reason they would pull the plan. If it's not profitable, not enough people enrolling in the plan, they can pull the plan. In fact, last year, 2.5 million people lost their Advantage plan. They eliminated those. And so my point is Medicare gives these companies the right to do whatever they want. Now, what happens to you as a consumer, if you're on an Advantage or a prescription drug plan, they have to notify you. They're supposed to, in writing, send you a book that's called an annual notice of change. They're supposed to have that in your hands by October 1, but certainly by the 15th of October, so that then you have this period of time of 7 weeks to be able to decide, do I want to be on this plan any longer? Is it still the best option for me? And so we go through this annual enrollment period. So because we have that, people think that the sky's the limit. They can just do whatever they want. And that's not true. So let me be specific now. If you enroll into an Advantage plan, let's say at age 65, and you stay on that plan for a year or 2 or 3 or 4 years, and then your health begins to change, and you would like to get off that Advantage plan because you don't want to run the risk of limited providers to see, or you don't want the hassles of pre-authorizations. You want to make sure that you have the very best coverage you can get, so you want to move from the Advantage over to that high-quality supplemental plan. Well, you cannot do that just because you want to. Why? Because once you've been on that plan a year plus, now you have to medically qualify. In most states, there's a couple exceptions, New York, Connecticut, Massachusetts, but everywhere else, to get off an Advantage and move to a supplemental plan, you're going to have to go through medical underwriting. Well, you want to switch because you're having health problems, so it's very likely that you're not going to be able to make it through medical underwriting. Companies are not obligated to take you as a supplemental client. They have the right to deny you. Now, when you first go on Medicare, they can't deny you. We call that the Medigap OEP. This is a time when people first go on Medicare A and B, and they have this 6-month window where they can get any Medicare supplemental plan they want without any underwriting. The insurance companies have to approve the policy. They have to issue it. They have to cover pre-existing conditions. They cannot charge you any additional money. And so that window, though, was only 6 months of your Medicare B date. We usually apply before, but once the B date starts, we're still in this window where we can do what we want. But after that, you just can't do what you want. And the whole issue is you have to realize that there are rules for going on plans and rules for switching plans. And again, the biggest one is getting off Advantage into subs. You'll probably have to medically qualify to make that move, which means what? Well, if you got diagnosed in the last couple of years after you've been on Advantage plan, you got diagnosed with rheumatoid arthritis, you're not going to switch. If you have spinal stenosis, you're not switching. You're a diabetic that takes more than 50 units of insulin a day, you're not going to get to switch. You just were diagnosed with AFib and you're taking medications for AFib, you're not going to get to switch. And I could go on and on because the list is large. And these are medical issues that really are not, frankly, life or death, but the insurance company says there's too much risk with you, we're not going to approve this policy, and they have every right to do that. All right, so my point is you have to be thinking long term, not just short term. I had a lady not long ago that one of my clients still is. We wrote her a Medicare Advantage plan at 65. Her plan was to stay on it until age 70, and she said, I'm going to take 5 years, I'm healthy, and after 5 years, I'm going to go on a supplemental plan. And that was her idea. That's what she intended to do. And literally 2 weeks before the open enrollment season, what happened was she was on my calendar. We're going to make a switch with her. And she goes to her dermatologist. They remove a mole, some kind of a skin issue, send it off for biopsy off, and it was melanoma. Well, I can't get her approved with melanoma. So she is still on her Advantage plan because why? You've got to be cancer-free, treatment-free. For some companies, 2 years, others 3 years. And she could not pass underwriting. And so those kind of things happen all the time. So I'm just saying to you, I want to make sure you're aware that when you make this decision and you stay on a plan for a lengthy period of time, that it could be something that you truly cannot reverse. All right? And so just want to make sure you're not mystified by that. In other words, you're not deceived by that particular myth when it comes to your Medicare decisions. All right, so I hope that was helpful. Erica, I'm ready to take questions.
Great, good stuff. Yeah, and I think that's why people get stressed. They're afraid of making the wrong decision or getting stuck on a plan. So that's why we're here to help and answer questions. So let's go to the phones and see if we have our first caller. Hello, and welcome to Medicare School Daily. Who do we have on the line with us?
Hi, my name's Tracy.
Hey, Tracy, where are you calling us from today?
I live in Illinois.
Illinois. All right. Well, we're happy to have you on the show today. What questions do you have for us?
My question is, I am turning 65 in March, and I was thinking about starting taking my Social Security, but my husband still works full-time, and he has excellent insurance. And I was just wondering, if I start taking Social Security, do they force you to take Medicare Part A and B, or can you keep the medical insurance that you have through an employer?
Sure. Yeah, you will not be forced to take Medicare B. You will have to have A if you take Social Security, which really is no big deal at all. So what I would do if I were going to apply for Social Security today for an effective date in March, what will happen is you're going through the application. They're going to ask you, do you want to take Part B? And then you just simply say no. It's no problem whatsoever. Now, I will kind of warn you, when you say no to the question on Part B, there will be a box that will come up and it says, warning, are you sure you don't want to take Part B? Because you could be penalized. And so in your situation, you wouldn't be penalized. So don't worry about the box. Just say, no, I don't want Part B, and just continue on with the Social Security application. And then they'll enroll you in A only. And then once your husband retires or his situation changes where you're going to lose active insurance, then you would go on B at a later date using the special enrollment period. So no problem, really whatsoever. Do you know what it cost him to cover you on your plan, Tracy? On his plan?
Yes, it's about $225 every 2 weeks, so about $450. But our deductible is real low. It's like $1,200.
Mm-hmm. Now, Tracy, is that $450 for both of you or just for you?
Just for me, his is free. His employer pays for his.
Okay, yeah. Well, I would tell you that Medicare is going to be a better value than that for sure. Yeah, Illinois is a great MedSup state. In fact, if you want to look at some rates, what we can do is we can send you a text, and you can actually call in and talk to one of our agents. But here's my point. My first question is this, Tracy: you and your husband, you file a joint return?
Yes.
Okay, good. Would you all be below $218,000 a year in income?
Yes.
You would be. Okay, so as long as you're below that, so just if you want to write this down, your Part B premium right now would be $202.90 a month, $202.90. Now, I can't quote every rate that's going on in Illinois right now, but I would say a G plan is going to be in the neighborhood of about $150 a month. It may be $10, $15 plus or minus that, but let's just say $150. So now we're at $353 for your plan. Do you take many medications?
I do an infusion once a week of Hyzentrix.
Mm-hmm. And you do that? You go to a facility, or is that you do that infusion at home?
My daughter-in-law is a nurse, so she does that for me at my house.
Okay. I would still suspect that that's still going to be covered by Medicare Part B. I don't want to say that it is for sure, but normally infusions, whether it's at home or in a facility, are covered by Medicare Part B. So once you've met your B deductible, if you had a G plan, that thing should be covered 100%. But that's something I'd want to check into for sure, whether it's a D plan coverage or a B. And then what other meds besides that do you take?
I take a blood pressure medicine, and I take one other medicine for, I do like a Brio every day for my asthma, and I have checked into that, and I don't believe that's covered under the Medicare drug plan.
But there are plenty of inhalers that are covered. You should be able to find one for sure. And again, if the Brio is the only thing you want, I can't say off the top of my head whether that's in formulary or not. But I do know there's plenty of others that are brand names if you would need those. So I guess what I'm trying to say is that as far as premium is concerned, you're looking at $450. You said you had a deductible about $1,500.
Yes, it's $1,200, $1,500. Yes.
Okay, very good. And so, does that include medications as well, as far as the deductible?
Yes, and I have already meant that for this year. Okay,
that makes sense. Now, beyond that deductible, do you have other max out of pocket, or is that's a total max out of pocket you have to spend for the whole year once you've reached that? Is that yes or no?
The max out of pocket is $2,500.
Okay, all right, yeah. Well, I think if I were you, I would take the time to make a comparison. You definitely have a decent plan for sure at work. So if you want to stay on that, no problem at all. But I do think Medicare would be very comparable. Your deductible would be $283 on the medical side. And then on the prescriptions, the most you'd ever spend would be $2,100. So it's about a wash. I can't say dogmatically that would for sure be your best move to go to Medicare. I could really go either way on that. But if you want some more details, I think it'd be nice to at least find out what drug plan would be best, what your exact premiums would be on the G, so you could respond to that text if you'd like. We'd be happy to make that comparison. And we'll be honest with you, Tracy. If we would say, hey, you're in a great position, stay with it. And if you're not, and we'd be happy to give that advice to if you want. Okay?
Okay, that sounds good. Thank you so much.
Yeah, we appreciate you calling in. Nice to talk with you.
You too.
Thanks
Have
so
a great
much.
day.
You too. Bye-bye.
Bye-bye.
All right. Yeah, it's interesting. And, I worked in pharmaceuticals for years, and I did look it up. It looks like that Brio Ellipta is covered by most Part D plans and Advantage plans, but it's a Tier 3 medication, it looks like, in a lot of those. But a lot of people don't know. Like, there's other, like you said, there's Advair. There's a lot of other medications like that where they could swap it out. So if you're listening and you're on an expensive medication, it's worth asking your doctor, is there something else that maybe is a generic? So, all right,
exactly
let's go to the phones and go to our next caller here. Hello, and you're on Medicare School Daily. Who do we have on the line with us?
Hi, my name's Mike.
Hey, Mike, how you doing today?
Pretty good. How are you?
Good, good. Can't complain. And what state are you calling us from?
On from the sunny state of Michigan.
All right. Probably as sunny as
Little tongue in
Indiana,
cheek.
where I am. And what questions do you have for us?
Well, the main question is, first off, I'll start by saying that I've been working with Jesse Fox, and he's going to be calling me in a few hours. But I'm a retired firefighter with a decent pension, which includes health care. It's a Blue Cross Blue Shield of Michigan PPO. That health care plan becomes second payer once I turn 65. However, my wife is a couple of years younger than me, so it will continue to be her primary. And I have a 22-year-old son who's finishing up college, and I've been paying COBRA so that he could be covered with that same plan. However, it's provided free of charge for my wife and I. But when this becomes second payer, I've been trying to figure out if this plan is going to provide adequate enough coverage. It's a great plan. I've been told that it's actually, they sent me a document from Blue Cross Blue Shield of Michigan, and it tells me about the benefits it's provided. And it calls itself, it says on the document, Blue Traditional Medicare Supplemental Coverage. But when I talk to people in our HR department, they say it's actually a 2+1 plan or traditional 2+1 plan. They call it a traditional straight Medicare supplemental coverage. It's an employer plan through an employer group. It's not a G plan or an N plan or anything like that. Mm-hmm, mm-hmm. And so when I look through this document, I see that that doesn't cover the gaps that I would have with my Medicare Part B for office visits and outpatient and home visits and office consultations. Mm-hmm. And so that leaves me with some concerns because I was recently diagnosed with cancer here in the last year. Now, I'll automatically enroll in the A and B because I'm on Social Security. I started taking that late last year. And I'm just trying to determine if this plan sounds to me like it's provided to me free for the rest of my life and my wife, but I'm wondering about what gaps, especially having a cancer diagnosis if it comes back, that out of pocket for those office visits and outpatient home visits and consultations would not be covered. So I'm looking for a little bit of advice.
Sure. Mike, let me ask you this. When you're looking at that documentation, are you saying they're clearly spelling out that they will not cover office visits, specialist visits? How are they wording that?
Okay. When I look under members' responsibility for deductibles, co-insurance, co-pays, and dollar maximums, it shows what original Medicare covers. It shows what my responsibility is. Then the next column is Medicare supplemental coverage, what my responsibilities are, and those are all say none. So it looks like everything's covered. But when I flip over to where it breaks it down and I get to physician office service benefits, original Medicare will cover 80% of office visits, outpatient and home visits, and office consultations covered at 80% of Medicare approved amount, less the Part B deductible. Right. And then under Medicare supplemental coverage, it just says not covered for each of those three items: office visits, outpatient and home visits, and office consultations.
Mm-hmm. Yeah. Well, let me ask you this then: what do you think it is going to cover, as it pays second to Medicare? Can you figure that out?
It covers pretty much, look at the hospital type of stuff.
Right.
Hospital care covers the Medicare deductible for the first 1 to 60 days.
Okay, so that's everything on the A side. Okay, well, I'm not tracking with you fully, Mike, because you're telling me that on one side it's covering everything, and now you're saying it's not covering everything. Here's what I want you to do, if you don't mind. Would you mind taking a picture of that, and then we're happy to look at that when our show is over today. So just take a picture. Can we get some kind of way to get that to us, Daniel or Josh? Is there a way? No way? Okay. Well,
I did send pictures of this to Jesse.
Oh, you did? Okay, very good.
We'll be meeting on the phone today.
Okay, well, listen, I'm in the office today after the show. What time's your appointment with him?
2:30.
Okay, I promise you, when the show's over, I'll go to Jesse's cubicle and I'll look at that paperwork for you, okay, and put my 2 cents in and make sure he knows that we gave you our opinion about that. Is that fair enough?
Sure.
Okay. I
Yeah, I
I'm really
appreciate
happy
this.
to
I'm
do
just
that.
trying to figure out. Yeah, I'm trying to decide if I want to keep this plan, which is provided for free, or do I want to get a G supplement
Right.
plan?
Well, if
which,
it's
of
not going to
course, I'm a
cover
little
any,
bit due to my-
if it's not going to cover any gaps for you, then that's not a very good deal, even if it is free. But I'll be shocked. My gut feeling is that it is probably going to be good coverage for you. But I'll confirm that today. After the show. Okay. And then Jesse will
Thank
talk
you,
with you
and,
about it.
And if I
Okay?
might. And if I might add, Marvin, you're a good man. I appreciate the service you guys provide.
Yeah, well, thanks for the encouragement, Mike. We love doing what we do. It's a privilege to serve people, and thanks for letting us help you. Have a good day.
You bet. And it shows. Thank you. Have a good day.
Yeah, see ya.
Bye-bye.
See ya. Bye bye. That's so tricky from employer to employer. I mean, my dad's a retired fireman in Ohio, and he has a Plan G. So you never know with these plans. So that's good. He's connecting with Jesse, and you guys can kind of take a look at exactly what that coverage is. So.
Yeah.
All right. So anybody who's listening right now, if you want us to take your calls live, give us a call. The number's there on the screen. It's 833-824-2004. Really anything Medicare or Social Security related. So let's go to the phone, see if we have another caller with us. Hello, you're on Medicare School Daily. Who do I have on the line with us?
Kevin?
Hi, Gavin. You said Gavin?
Kevin.
Kevin. I'm sorry, Kevin. How are you doing today, Kevin?
All right.
Good. Glad to hear that. And what state are you calling us from?
Louisiana.
Okay.
Louisiana. All right. And what questions do you have today?
Well, my major situation is when I retired, I was forced into retirement at 62 due to disabilities. So, anyway, at 65, they took me off of Medicaid, and and then with the cost of living allowances, this COLA, over the years I've progressed up to where I don't qualify for extra help or anything. And now this year my meds are just way out of reach for me. I'm on they call it People's Health here. It's United Healthcare. And I have it's like $496 a month for my Ozempic, and then another $400 for Jardiance. I'm on diabetes. I can't afford these things. What are my options?
Okay. Well, what I'd first of all I'd check into in the state of Louisiana, Kevin, would be if they have a state pharmaceutical assistance program. State pharmaceutical assistance program. Sometimes those can be helpful. Now, not every state has those, or if they have them, sometimes the enrollment is not open very long. There's only so many people that can participate. So that's one thing I would encourage you to check into. The second thing is this year. Let me go back and ask you a question first. So you said people. So is this on? Are you on some type of a Medicare Advantage plan, or is this it didn't sound like a supplemental plan? As far as the medical.
It's the Advantage plan.
Okay, yeah, that's what I was thinking. And so you said you do not qualify for Medicaid. Is that correct?
Correct.
Okay, all right, sounds good. So what happens on these plans? I know you've said $496 in the Ozempic and the Jardiance, and you're right; those are very expensive. But the most you'll spend this year, Kevin, out of pocket on those meds, as long as they're in formulary, and I'm almost sure they are going to be in almost every formulary, would be $2,100 for the whole year. And if you cannot afford to pay that $2,100 right now, what you can do is you can enroll into what is called a Medicare prescription payment plan, and your Advantage plan will do that for you. You usually just call in and let them know you want to enroll in that plan. And what they do, it doesn't save you money, but what it does, it takes that $2,100 max out of pocket and it spreads it out for the whole year. So that way you only have to come up with maybe a couple $100 during the month, and like I said, they'll spread that out. and so that's an option as well. So your SPAP, State Pharmaceutical Assistance Program, I check into that, and then let's make sure that your meds are in formulary for sure. And then one thing you may want to consider, and if you're happy with the plan, I want you to stay on it. But if you want us to reshop that and just look at that, we would be happy to do that, because what we're in the period of time right now called the Medicare Advantage OEP. And that goes from January 1 to March 31st. So if there is a plan that would be better for you, from a prescription standpoint or for whatever, then you can still switch those plans. And so what we could do, if you'd like, we can send you a text, and then you could follow up with that, and then you could speak to one of our agents. And just to make sure you're on the right plan. If you are, we'll tell you that. If you're not, then there may be something that's a better option, and you still can switch all the way through the end of March. Okay, so those are my suggestions. Erica, do you have any other thoughts or ideas on that one?
The only thing I was going to ask is, could somebody with diabetes like this that's having trouble with the cost of the medication, would a C-SNP plan help at all, like a chronic illness special needs plan with bringing the medication costs down?
It could. It really, really could. So, Kevin, that's something, what she's talking about, it's called a chronic SNP plan. SNP stands for Special Needs Plan. Chronic means there are certain illnesses. Diabetes would be the number one, where they have plans specifically designed for diabetics. And Erica, I think it's a great idea. So Kevin, will you do me a favor? Follow up on that text line when we send it to you, and you'll be able to then talk to one of our agents and ask them about the chronic SNP plans in your market. Not every market has them, but many, many do. And so I would suspect there's probably something that would be available. So if you wouldn't mind doing that, I think that'd be the best way to double check to make sure you're on the right plan. Okay?
Okay. That drug cost is on the SNP plan.
Oh, okay.
Okay. So are you saying that you already are on a chronic SNP plan?
Yes.
Okay. Very good. Well, let me ask you this: would you be able to afford it if it was spread out throughout the year? Because you're still early on. You could spread it out. Would that be possible?
Well, my situation is, I got caught off guard with the disability,
Mm-hmm.
and being on the low income, I'm still paying out stuff for my business I lost, and so I'm where I just barely make it by. I just have enough to make it by.
I understand.
I don't have extra money to even pay the $175 a month for the spreading out to $2,100.
Yeah. Okay.
So,
well, let me ask you this. Can you, what you may be able to do is reach out to the manufacturer. I know sometimes they have some programs that may be an option. I think the SPAP is still your best option if Louisiana has one of those. I'm really
there's
sorry.
only one insurance company that has a SNAP program, and like I say, they're the ones that are costing me $496 a month.
Yeah, I'm not talking about that. Erica, is it possible for you to Google a state pharmaceutical assistance program in Louisiana and see if they have a number?
I did.
Go ahead. Do they have one?
Yeah, let's see if I can get a phone number for it.
Yes, Kevin. Then you call. We're talking about two different things here. Yeah, one is the state pharmaceutical assistance plan, and then the other one is called special needs plan, which of course is your Medicare Advantage. So two separate programs here.
Okay, I apparently make, I'm right there in limbo where I make just over the maximum amount to get on these plans.
Yeah. I would still check the state plan. I really would. If you haven't, at least it certainly wouldn't hurt. So, Erica, do you have that number we can give to him?
Yeah, I'm pulling it up right now here. Okay. There's a couple things that look a little gimmicky, like their company's trying to sell you something. So I want to get the right phone number here.
Okay, very good.
So I'm going to give you a phone number here, Kevin. Try this. This is for the Louisiana drug card. It's a free prescription drug discount card. I'll give you a couple different phone numbers. Try 877-454-8255. 8787. And
Yeah.
there's also another number that connects seniors to manufacturer assistance programs. So let me give you this quick number as well too. Try
Okay.
878.
Now, as far as the manufacturer, I'm on Ozempic. That's the excuse me, highest price one there. I was on the manufacturer's assistance program, but they said since this new Trump RX, they won't do the program anymore.
Because they've lowered the cost. That's one of the medications where they've lowered the cost of it. So, well, I would try that Louisiana drug card, that 877-454-8787 number, because that's probably going to be like a state assistance program. That might be a good starting place to call and see where it goes from there.
Okay.
Yeah. Just be cautious, Kevin.
Yeah, just be
some
careful.
of these places, they have all kinds of toll-free numbers, and they're really just Medicare Advantage brokers that are bait and switch. So hopefully that is the right number. All right, let's.
Yeah. And I was going to say too, they have a number here for Medicare Extra Help, the 1-800 Medicare number. I know you said you don't qualify for extra help, but they might be able to give you guidance on something else where they could assist you and help you. And that number's 1-800 Medicare.
Okay.
All right, Kevin.
Okay.
Hey, sorry we weren't able to help you any further than that, sir.
Thank you very much.
Okay, appreciate
All right.
you calling today. Have a good one.
Good
Have a
luck to you,
wonderful day.
Kevin. Thank you. You too.
All right, bye.
Bye. All right, we've got our next caller on the line here. Welcome to Medicare School Daily. Who do I have on the line with us?
Hello.
Hello. Hi. Who's calling in? What's your name?
This is Gary from Illinois.
Hi, Gary. How are you? We got a lot of Illinois
All right.
people listening today. We've had a couple people from Illinois. So, what questions do you have for us today?
I think it's 3 maybe. First question, I turned 65 in July. I am employed. I have a good plan, but my plan is switched away from my hospital, and doctors, which is down the street. I've been with them for years. My grandkids were born there. So I got a letter saying that they're no longer going to be at that hospital. It's a PPO. I don't know if I should mention the company.
Oh, it's fine. Either way,
So
we're good.
Okay, so what I want to do is I want to switch from the company plan while I'm still at work to the Medicare, A, B, G, D, and everything, because I did ask everyone that, and they said, yeah, we accept Medicare, so I was thinking, should I switch and stay with the people I always had, or stay with the plan and then find some hospital way far away from me? And then the next question is, I just realized that in my retirement plan, I'm going to spend maybe 2 months out of the year in the winter someplace warm. Should I take that into account?
Okay. Are those all your questions?
Yeah, I think it is. Yeah.
Okay, very good. Well, number one, I think that you're thinking correctly in that I would not want to change providers, because that can be painful. So I would try to stick with the provider, and going on Medicare in your situation makes sense. I'm not sure exactly, economically, what it costs you to be on your group plan, but if you can't go to the providers you want, especially the hospital you'd like to go to, I think going to Medicare does make sense. Now, Gary, are you single or married?
Widow.
Okay, very good. So is your income as a single filer below $109,000 a year?
Yes.
Okay, very good. So that way you get by with the base premium for your Medicare Part B. So you're looking in the neighborhood somewhere probably between about $350 to $400 a month for very, very good coverage. And you can go to the providers that you want. And if you do travel a couple months out of the year, as long as it's within the U.S. or U.S. territories, you're just as much covered anywhere as you would be in Illinois. And that's one of the benefits, I think, of a supplemental plan and Medicare, because everyone knows how that system works. They recognize that you're not going to have any difficulties while you're on the road. Anything were to happen, pull out your red, white, and blue card and pull out your supplemental card, whatever company you choose. You'll have great coverage and no complications at all. So to me, it really fits your situation very well. Now, I'm assuming you're not on. Oh, I'm sorry. Go ahead.
No, I pay about $380 a month. Well, it's not a month. It's a month. But it's taken out of my paycheck.
Sure. Yeah. Well, you have every right, of course, to go on Medicare. I'm assuming you're not ready to take Social Security. Would that be correct?
Well, I was planning on when I leave to retire on my wife's Social Security.
Okay.
And leave mine alone till I'm 70.
Okay, and that's good. Yeah, that's a real good decision. So, are you thinking about doing all this in July?
I was thinking about switching plans in July, but I might work through the end of the year or so.
Okay.
Or it depends on how I can get all my stuff organized.
Okay. Sounds good.
My goal is to maybe make this my last year working. But if I have to, I can continue on.
All right.
Well, but my job is making it harder. They want to play bonuses to state.
Okay. Well, it sounds like to me you're going to delay Social Security at least for a few more months until you stop working. So, your date of birth is it July 1st or is it after? Okay, very good. So just back it up 3 months. So June, May, April. So anytime after April 1, you can enroll into Medicare. And you don't have to enroll in Medicare for April, but April's your very first month of eligibility. So you can enroll into Medicare. All you have to have is an SSA.gov account. And if you want to use our company as your broker, which we'd be thrilled to help you, we'll do all that for you. But anyways, you enroll in Medicare A and B sometime around April or May. Everything will go into effect July 1, and then, of course, pick out a supplemental plan. And I would either do a G plan or an N plan. They're both excellent options. And then we'd give you direction on your prescription drug plan as well. Okay, and that prescription drug plan would cover you anywhere in the country also. Okay. So. Okay,
I was interested. I'll probably go with a G. Well, one other thing is that there's going to be a gap between in April. I think they're going to stop using that hospital. So, between April and July, I guess I either go out of network or follow them, or I'm kind of in a talk on that part.
Right. Yeah, I understand that.
That is I really don't want to go.
Mm-hmm. Yeah. Well,
but I was thinking, what should I do? And I was saying, I'm willing to go out of network, or I can extend my my visits to my doctor until it goes past that time, into the fall, or just pay out of network for that time period.
Yeah, that's probably, and of course we're talking about only a couple of months, so hopefully nothing will happen to you during April, May, or June, so you'll be able to not even have that, faced with that challenge. But I agree with you. I would still go to them and just pay the out-of-network price.
Okay.
Okay.
All right. Thank you.
All right. Well, hey, we appreciate you.
I really enjoyed the show. I recommend it to all my friends and everyone to learn, because they are going through it and they are doing everything wrong, and they have to, partake the information you gave me on the show to them, and then they have to, and then I gave them a link to your show, and they're learning too.
Good. That's great. Well, we appreciate you doing that. And if you want us to be your broker, let us know. We'd be thrilled to be of help to you,
I
sir.
will.
Okay.
I want you to.
Okay. Sounds great. Well, thanks for calling in. Enjoyed talking to you today. See you.
All right,
yeah.
Bye-bye.
Thank you. Thank you. Yeah, it's so interesting. The people, a lot of people, they're willing to pay the extra money for a supplemental plan for that flexibility. Like they say, he said, my grandkids were born at that hospital, right? That's his doctor's. He doesn't want to change. So, all right. Let's see if we have another caller on the line. Hello, and welcome to Medicare School Daily. Who's calling in? What?
My name is Janice.
Hi, Janice. Where are you calling us from today?
From Massachusetts.
All right.
Nice. And what questions do you have for us?
So I have two questions. One has to do with the Massachusetts supplement plans. The Blue Cross Blue Shield specifically, I just went to my doctor's yesterday, and they have a nice brochure on comparing the different plans. They have a core, a sapphire, and a bronze. And I went to a seminar over a year ago where they said you could switch from supplement plan to supplement plan in our state because we have special rules in Massachusetts.
Mm-hmm.
So they said, for instance, you go to your doctor and they say you need your hip replaced and you're on the lowest plan and you want to up your plan coverage for the next month. You can call in and get the higher coverage plan. And as long as it's, in by the first of the month, the next month, you get charged, and then you can switch it back if you need to. Have you heard of this?
Mm-hmm. We have. You all would have year-round open enrollment in Massachusetts. And we call your state a waiver state. It's like Wisconsin and Minnesota. You all have your own designed Medicare supplemental plans. They're very similar to a typical G plan or an N plan. They just call them something differently, and they structure them differently. So we're familiar with that, and so I think it's wonderful. I will tell you this, Janice. I was not aware that you could do that month to month, but that makes sense. So a lot of states will let you, not a lot, many states will let you do that, but they restrict it to certain periods of time. But that does make sense that Massachusetts would make that available. So we'd call that an open a year-round open enrollment. New York's like that, Connecticut's like that. So that's good. That's awesome.
Okay.
And so I think you're smart in leaning towards taking a supplemental plan or a core plus some riders to make that equivalent of a G or an N plan. That really is the best way to go. I just started Medicare in January, and I went with the G plan. And so I think supplemental plans are wonderful. You got to pay a little extra for them, but I think the benefits are great. No network issues, no pre-authorizations, all those things are certainly worth the money to me. So good choice there, Janice.
Definitely.
Yeah.
All right, awesome. And then I do have another question regarding Social Security. Is it okay to get two questions in
Yes,
today?
no problem.
Okay, thank you. Excuse me, I have a little cough. Social Security, I'm starting it this month. I'm 64, and I also concurrently started a job that is commission-based. Mm-hmm. So I am going to, as soon as I get my first check, I'm going to give my notice to my part-time job because I would make too much money if I kept working that job and got a commission. Mm-hmm. So I, have only had a couple of months worth of, part-time employment. When I looked this up, it said that I have to notify Social Security if I exceed either the annual wages for the year for not being my full retirement or the net wages for my income. So for instance, if I get a real estate commission and I have a lot of expenses, I could just take the net income, and if it exceeded, I think it's $5,000 or so for the monthly, and I call Social Security, is that my one time I'm allowed to change my Social Security?
Okay. Well, first off, the $5,000 number does not apply to you yet. If you're going to take that would only be for people that the year that we turn full retirement age, and of course you're not there yet. For you that'll be 67. So I promise that $5,000 number does not apply to you. What does apply to you is the annual amount for you is $23,000. I think it's $150, $23,150. So you would take that number and divide that by 12, which is going to be a little just right, like little $2,000. So you're allowed to make up to $2,000 in wages, and anything above that, then they're going to penalize you. So those are your numbers.
Right.
Yeah. And so as far as what was your last question? I'm sorry, I forgot it.
Well, is that the one time? Because I sat down with someone at Social Security, and they explained to me, you can change your Social Security one time, and they said to me, the example would be, you made a huge amount of commissions and you definitely went over the annual amount. So they said, you can come in and you can tell us to stop your Social Security, and then you have to pay back anything that you've received.
That's right.
But we will hold your Social Security until your full retirement now, and you'll get the higher amount when you hit that.
And that is correct. They give everyone the very first year. You can reverse your decision, and again, like you said, pay the money back. So that would be the one time, and then after the 1 year, then that would not be even possible. Now, what is interesting, once someone hits full retirement age, then they can actually stop it again if they want, so that money can continue to grow. That's possible as well. But if we take before full retirement age, we have one time, pay the money back, and that is you're eligible for just 1 year. So that's it.
Okay.
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 So
yeah, that's perfect.
Hope that helps.
Well, that does help. That does help. And I appreciated the talk on the D plans too. That's something we're going to continue to look at, because my husband has 3 prescription medications, pretty simple stuff, but we're just looking at the different plans that we would get on top of our supplement plan.
Sure. Well, that's good. Good.
Drugs.
And if you decide you need some assistance, we write plans in Massachusetts all the time, so we'd be happy to assist if you'd like. But we
Great.
appreciate you calling in today,
that.
Janice. Nice of you.
All right. Thanks a lot.
Thanks,
You
Janice.
have a good day.
Take care.
Take care.
Thank you so much. Take care. Bye-bye.
All right, yeah, I love so many people refer to the videos. If you're watching this and you stumbled upon it, we have a whole YouTube channel with a lot of videos that teaches all of this stuff on Social Security, Medicare, IRMAs, all that good stuff. So, all right, let's see if we have another caller on the line. Hello, and welcome to Medicare School Daily. Who do we have on the line with us?
Hi, this is Carrie Oreska.
Hi, Carrie. And
Hi,
what
Carrie.
state are you calling us from today?
Connecticut.
Connecticut. All right. And what questions do you have?
I have I'll be 65 September 1st of this year, and I have a broker that I've been working with regarding Medicare, and she's thinking it's best to get me on the high deductible G because of my healthy history, but I kind of have a little hesitancy whether I should just go on the N plan or if I should sign up for the high deductible J.
Okay. Well, I am not a huge fan of high deductible G. I think the one of the issues with them, and again, I don't know what carrier she's recommending. Every carrier treats the high G a little bit differently when it comes to getting off of the high G. So if you decided 5 years from now you want to get off, or 3 years from now you want to get off, I want to know what the rules are of getting off that plan and taking another type of plan, a regular G or an N. Would you have to go through underwriting to do that? So that's number one. What's it look like to get off of it? And the reason I'm saying that is because sometimes people later in life want to get off those. That we used to have high deductible F plans. And so sometimes people would have health problems. Now they want to move, but they can't get off because they can't medically qualify. And I think this year, is that deductible $29.50? We don't write a lot of high Gs, so I'm thinking it's like $29.50. Okay, so obviously you'd be responsible to pay. Medicare pays their part, but your supplemental plan is not going to pay anything until you've met that out of pocket. So that definitely would be an issue with me. Can you get off of it? What are the rules for doing that? I would prefer to pay, well, I don't know exactly what rates are in Connecticut, but is it maybe the difference between a high G and an N plan, maybe what, $50, $60 a month? What's the difference?
Well, I have not. We've met briefly. We haven't actually discussed plans and prices at this point in time. I'm going to meet her June. Since I have a September 1st birthday, I'm meeting with her in the beginning of June to get this all buttoned up and get myself on a plan. So she's just really pushing the high deductible G. She says, you know what, you're healthy, you don't have any problems, you live in Connecticut. Now that's my other question is, living in Connecticut, do I have the ability to be able to just swap in and out when I want to?
Yeah, and that is true. That is true. Connecticut is a year-round open enrollment state, so you would be able to do that. And honestly, I forgot about that. Yeah. New York's like that. Connecticut's like that. So you could do that, which is good. The only thing I would say about pushing a high G, I mean, I've been in this business 17 years, and so people's health can change very quickly.
Sure. I'm a nurse.
Yeah,
so I know
yeah,
that for sure.
So that doesn't hold a lot of water with me. But the fact that you're in Connecticut is very nice. And then in Connecticut, I guess you'd have to find out, can you do that monthly? We just had a lady calling from Massachusetts, and she said they can change monthly. So if you got diagnosed with cancer, right now she said you could be on a new plan by March 1. So it'd be nice to know if Connecticut allows that as well, or is there a certain time of the year where you can, switch your plans with no underwriting. So I'd want to do that.
Right.
We don't push a plan like the high G, only because in most states you can never get off of that once you've been on it for a year. And so now people have to live with that issue. So, anyways, but I'd find out the end prices, and if you want a second opinion, Carrie, we'd be happy to talk with you about that. Okay.
Okay. Also, she says that being on the high deductible G, since I do have an HSA from my employer, which I just stopped because I need to stop that 6 months before I go on Medicare, so I don't get penalized. She says, you can pay your yearly high deductible G out of your HSA, and I have $24,000 in that. So she says, you know what, you can just keep paying out of that until you're at a zero balance, and then you can go on a G or an N plan. And I'm like, oh, is it really that easy? I mean, do I just?
Yeah, and that is true.
Do I just?
It is true that whatever the deductible is, you cannot pay your premium for your high G, which is not much anyways. You cannot pay the premium out of your HSA, but you can cover that $29.50 would be eligible for HSA for sure. So in that, she's right. Hey, I want to clarify something just so you know. You do not have to stop your HSA contributions 6 months prior. Some people have to, but not you. You actually you can contribute all the way up until July. So you do not have to stop 6 months. Yes, exactly right. What that 6 month rule is, and there's a lot of confusion, it doesn't apply to your situation because you're going to start Medicare at 65. So truly, let's see, you said your birthday was September, so you're going to start Medicare. Start Medicare in August, so you can go all the way up until July. And if you're maxing out, then it is prorated for the year. But right now, I think it's like $450 a month. So you can put the full amount in up until July, no problem. The 6 month rule applies when people do not go on Medicare at 65, and then let's say they go on Medicare at 68, and once they decide to enroll, then they back the clock up 6 months. That's when the backdating of the A occurs, but not in your situation. So truly, you are fine up until July. Okay.
Do you think I should re-enroll in my HSA then? Should I re-enroll, or is this?
If you can, I would. If you got several months, you can contribute. Now, if I'm putting $50 a month in, probably wouldn't hassle with it. But if you're maxing out and you can re-enroll, I'm maxing out. I definitely would for sure. That's pre-tax money, and one of the nice things about that, once you hit 65, if let's say if you have a lot in there and you're not going to use it, you can just treat that like an IRA. There's no penalty. You can convert it and pay taxes on it. So I definitely would be re-enrolling if your company will allow you to do so. But you're fine through a July contribution for sure.
Okay, so I should just see what the rules are for the high deductible G as far as being able to swap out of that. If I need to,
yeah, exactly. Plus Connecticut, you live in a state that allows it, so that's awesome. Okay.
Yeah. Okay. Great. Okay. Thank you, Marvin.
Yeah. Well, good talking to you. We appreciate you calling.
You too.
Okay,
thank you.
All right. Thanks for calling in. Hello and welcome to Medicare School Daily. Who do we have on the line with us?
Hello, Tom from Washington State.
Hi, Tom. How are you doing today?
Good.
Great. And what questions do you have for us?
Well, I have a question about, I just got married last November, so I have a question about spousal benefits, both on Medicare and Social Security.
Okay.
And I should probably start at the end and ask what would they get if I pass away? I'm over 70 right now. Just turned 70. I'm starting Social Security right now. So if I pass away, would they get my full benefit on Social Security?
When you mean they, you mean like a previous spouse and your new spouse?
No, my new spouse
Okay,
only.
yeah, your new spouse, yes. Yeah, so here's the way it works. They would get whatever amount you're getting, they would get. And so you'd have to be married for, I want to say 9 months, or is it 3
Yeah.
months?
It's
I forget
9 months. I think it's
Thank
9
you.
months. Yeah.
Very good. So as long as you're married 9 months, then your spouse will be eligible for whatever you're getting. So if you're
Wow.
above 70, whatever that amount is. Now, when people take from a living spouse, it's limited to 50%. But with a deceased spouse, it is truly 100%. And just so you know, the way it works technically is if your wife is getting her own Social Security, she will continue to get that amount, and they top up to what your balance is. So let's say yours is $4,000. Hers on her own is $2,000. Technically, she's going to get her own $2,000 and then an additional bump up of $2,000 to equal your full amount. It's the same numbers are the same, but that's how the system works. It's topped up to your
They'll
benefit
take out
amount.
hers first.
Pardon me.
Okay.
Yeah, exactly right. She still gets hers, but they'll top it up to equal your full amount.
And what about Medicare?
Okay.
Is it like a work plan where they can get on my Medicare? Even now
No,
or
no.
after I
Medicare
pass?
would be individual, but she can qualify for, if she does not have her own 40 quarters, she can qualify from you, but you have to be married for 1 year or longer, and then she can draw her 40 quarters. Does she not have 40 quarters? Which is 10 years
No,
worth
she's
of work?
only worked 1 year.
Okay, very good. Yeah,
No,
it'll be fine. Just once you married for 1 year, then she'd be able to make application. You can't do that online. You'd have to call the local Social Security office and tell them the situation. They're going to ask for a proof of marriage license, and as long as it's over a year, then she can draw her benefits off of you for sure. How old is she?
55.
Okay, very good. All right. Well, she can't do that, of course, until she's 65. But once she turns 65, then she'd be able to draw benefits off of your work record.
Okay.
Yeah.
And so she can just apply and she'll have the same Medicare that I have here on Plan G?
Yeah, absolutely. Yeah, no problem at all. Her eligibility will just come from your work record. So what I would do in that situation is about 4 or 5 months before she turns 65, I would call into the local office and set up a phone appointment to make that application. Just be sure you all have a marriage license handy, because they're going to ask you to send that to them, and that's it. Really quite simple. You can't make an
And do
application like that online, though, at least not presently.
Okay. And will they pay the $202.90 a month?
Yeah. So, well, of course, she's 10 years away, so right now it is $202.90 a month. I'm sure it'll be more then.
Yeah, whatever it'll be then.
Yeah, exactly right. So the way that works, as long
Or
as
if
your
there's a minimum.
combined income is below 2.8, like this year, you have to a ceiling of $218,000 for a married couple filing a joint return. So we stay below 218.
Yeah.
Then it'd be a 202.90.
Okay. Wow, very good.
Okay. Anything else,
Very
Tom?
good. And if I pass, they'd stay on that Medicare plan also?
Oh yeah.
So continue.
Well, yeah, exactly right. Yeah, she'll never lose her eligibility of Medicare once she's on it. And now let me explain this. I hope you live a long time, but if you were to pass away, if you were to pass away, and then she were to remarry, as long as she remarried after the age of 60, then she would always be able to be eligible for your benefits. So whenever there's a remarriage prior to the age of 60, then we can't go back to the ex-spouse or deceased spouse.
Okay.
Make sense?
But she'll need to be 65 to get on it.
No, sir. That's not what I'm saying. No, she'll have to be 65 to be able to start her Medicare, and then she could, of course, start Social Security earlier than that at 62. But she would take a penalty, of course, because she hasn't yet reached her full retirement age. What I was saying is, if you happen to pass away and she were to remarry, I'm saying you died a year from now, and she remarries. If she remarried prior to her turning 60 years old, she would not be eligible then to draw benefits off of your work record.
Oh, okay.
Okay.
Okay, very well.
All right. Sounds good.
All right.
I got a little weedy there with you, but I wanted to clarify that because it does matter.
Yeah, it does. Thank you very much.
Tom, nice talking to you, sir.
Thank
We
you.
appreciate you calling in.
Thank you
you.
very much. I'll be on
Okay.
the chat here. now.
Okay. Yeah.
Thank you. Bye-bye.
Bye.
All right. Hello and welcome to Medicare School Daily. Who do I have on the line with me?
This is Jill.
Hi, Jill.
Jill.
And what state are you calling us from today?
Virginia.
Virginia. All right, perfect. And what questions do you have for us?
So I have Medicare Part G, and I have signed up for Part A. It's not in effect yet. And I wondered if there is anything that Part G pays for when you don't have Part B yet.
Okay. Yes. Well, yeah, you really cannot enroll. Well, let me say it this way. You can enroll and pick up a Plan G, but once it goes into effect, the G is not going to pay anything unless you're enrolled in both A and B. Does that make sense? So point is,
it makes sense.
You have to have A and B to have your G plan. But there's sometimes people will enroll in A only, and they'll go ahead and make their G decision, for a future date. Because some states we can start 3 months in advance, some states 6 months in advance, and so then, but you're going to have to add B before that G plan actually goes into effect. Okay.
Okay.
Yeah. So and then you have great coverage, of course, because it pays everything, of course, except the Medicare B deductible. So now, are you planning on adding B down the road, or are you going to?
Yes.
Okay.
What happened? I applied for Part B, and somehow they lost my paperwork, and so I just resent my paperwork last week. I'm just waiting for them to approve it.
Now, did you have to do some kind of the special enrollment paperwork, or did you, in other words, were you coming off of a group plan from work, or just starting Medicare 65?
Yep, I was finishing up a group plan at work.
Okay.
And yeah.
All right, that sounds good. Well, Jill, what's your birth month and year?
November 1960.
Okay, very good. All right, so, if that was I got it. That sounds good. That's what. Yeah, you came in an SCP. So let me ask you, just for my own curiosity, did you fax the paperwork in and they didn't receive it, or did you mail it in? What happened?
I emailed it. I went through you guys. Emailed it to you guys. Your team faxed it, and can show that they faxed it.
Yeah.
But Medicare for some reason didn't get it.
Okay.
And I should have checked in
Well,
earlier.
Jill, let me tell you, and I'm gonna remind all of our agents, and hey, we fax in all the time, but I always tell people, mail a hard copy in also. You need to mail a hard copy in, and we always put a note on there saying, I faxed this in, whatever date it is, but I'm mailing this hard copy to make sure you got it. Because I hate that we've had it happen plenty of times. That's why we started doing a hard copy as well. So I'm sorry we didn't tell you to do that. But anyways, you got it taken care of. That's fine. We like to fax and mail. Best is drop off, but sometimes that's not always convenient to do that or possible. So fax and mail is really a preferred method. Okay.
Okay.
All right, Jill. Well, thanks for letting us serve as your broker. And anytime we can help, let us know, please.
All right. Thank you.
Take
Bye-bye.
care.
Thanks, Jill. Bye. Take care. Now, November birthday, she'd say November birthday, she'd still be in her IEP, wouldn't she? Yeah.
She would be. Yeah.
All right. Do we have anybody else on the line? Another caller on the line? Hello. We got our last caller of the day. Who do I have on the line with me?
My name is Flo.
Hi, Flo.
I'm in I'm in Afton, Virginia, on a mountain.
All right.
Oh, nice. What questions do you have for us today?
The question I have is that first of all, I really want to thank you all and thank Marvin for doing this. I started listening to Marvin in 2020, and it changed everything I did. And it made it so easy that it makes me wonder why people get so confused about Medicare. Yeah. And I love the fact that his intention is to educate everyone, and whoever becomes your client is fine, but just to educate everyone.
Yeah. Well, thanks for the encouragement, Flo. And I'm glad we met you. 2020. Wow, that's amazing.
It was Matthew Cano.
Yeah, Matthew Cano.
I think who did my Cano, who did my things originally, and then my brother. I did things I hooked my brother up, and Andrew Forrester did ours.
Yes.
Oh,
well,
nice.
that's great. That's great. Well, we're glad we met you that way. And in fact, that was pretty early on when we started our channel and everything. So, it's interesting.
Is it really?
Yeah. Well, we used to do live workshops all over the country, actually.
Right.
And then had to go online, and we're glad we had to. COVID was a bad deal, but it sure allowed our business to have a greater impact. So for that, it kind of worked out well.
That's fabulous.
Yes.
And I will tell you that one of the reasons, because I was, approaching 65, so I got about 320 emails or things a day about Medicare.
Yeah. Mm-hmm.
And the reason I went with yours was because you didn't ask us for any information.
Yeah.
Other places wanted your full name and your social security number and your email address and your phone number and all this other stuff. And you just said, this is our website. Here's the link for our webinar. Join us.
Yeah.
And you didn't ask for any other information.
Yeah.
And that really made the decision for me getting in, following your processes.
Good. Flo, when Josh and I started this company now 17 years ago, we really did want to do things differently. We wanted to be educators and no pressure. I mean, we're obviously we love to write plans and help people, but that we just want the relationship to be different. We don't high pressure. It's just not our heart whatsoever. And fortunately, we have agents like you met, Matt Cano, Andrew Forrester, same philosophy. So anyways, we're glad that we got to help you. Anything you want to talk about today?
Yes, I wanted to, I have a question, and I'm not looking for you to be my financial advisor, but you may have a direction for me to go in here. Now, there are things that I'm 70, and it's still hard for me to actually say those words. I'm 70, and then I know they recently changed things so you don't have to take a required minimum distribution till 73. But when you do take that will affect your income for that year. So will that affect my payment for my supplement?
Not for your supplement. It could affect what you're going to pay for your Part B. So, Flo, are you single or are you married?
I am happily single.
Okay, very good. The reason I asked, let's just use it if it was this year. I know you're 3 years out before you have to start your RMDs, but if it were this year, as long as your total income was below $109,000, including your RMDs, then there will be no impact at all on your Part B premium. Again, supplemental plans and drug plans, supplemental plans are not affected at all by income. It's only your drug plan, Part D, and your Part B. But again, there's those thresholds. So in 3 years from now, I don't know what the threshold will be, but it'll probably be $125,000 or something like that. And so
3 years from now, who knows what this country will be like?
Yeah, you're right. You're right. So right now, the way to look at it, Flo, is it's about whatever the balance is in your account. You're going to have to take roughly around 4 to 5% is what your RMD will be. And of course, that goes up a little bit percentage every year. But yeah, that's a good ballpark. 4 to 5% of that balance will be your RMD amount.
Great.
Okay.
Well, good.
All right. Anything else today?
No, but thank you for doing this too.
Yeah.
I think I hope it'll be an absolutely wonderful avenue for for people to learn from.
Yes, we do too. We're excited about it. Of course, like Erica said when you started the show, it's still brand new. This is our second week, but we're gonna continue on. We love doing it, and we hope we get to reach a lot of people as well and help folks. So, thanks for letting us serve you, Flo. You take care and have a good rest of your day.
Thank you.
Okay.
Thanks,
God bless. Bye-bye.
You too. Bye.
Thank you, Flo, and thanks for the kind words. So it's always good to hear happy customers. So All right. So we are happy to answer your questions today. This is always fun to get to talk to you guys live. If we didn't get your question today, we will be back tomorrow. We're actually on the show Monday through Thursday, 10:30 Central Standard Time to 11:30 Central Standard Time. So we will see you tomorrow. You've got the number to call in. And if you need help today, though, we've got about 35 agents that are literally on the other side of the wall there that are waiting to help people. And they are all Medicare experts. And we call them guides because of exactly what Marvin said. We don't want to be pushy salespeople. We want to educate you and help guide you into what's going to be the best decision and the best plan for you. So let me give you this number. If you need help today, you can call 833-833-3661. And you can also always go to MedicareSchool.com and schedule an appointment with one of our guides. So thanks so much for watching, and we will talk to you all tomorrow.